Section 1. What really happens to your erection at night after 60? Men in their 20s and 30s don't think about this at all. They go to bed, they wake up, and it simply appears. But once you hit your 50s, and especially your 60s, the body begins to shift how it runs its nightly maintenance routines. Let me paint the full picture for you. When you enter REM sleep, the deepest layer of rest, your brain shuts down certain stress systems and ramps up circulation to several key areas of your body. One of those areas is your pelvic region. Men are supposed to experience multiple spontaneous erections during the night. These aren't sexual, they're mechanical, they're maintenance. Think of it like this. Every night, your body is supposed to test your circulation the same way a pilot tests every switch before a flight. When these nighttime erections disappear or weaken, the tissue inside the penis does not receive regular oxygen. And without proper oxygenation, that spongy erectile tissue becomes less elastic, the same way an unused muscle weakens. Now, add two more common changes that happen after 60. Number 1. Less REM sleep. Older men often get lighter, more fragmented rest. Without deep REM sleep, the erection cycles simply don't happen. Number 2. Pelvic congestion. This is something men rarely talk about. Over time, the tissues around the prostate can become tight, swollen, or poorly circulated, especially if you sit a lot or get up frequently to urinate at night. That congestion restricts blood flow, and if blood can't enter easily, erections cannot form easily. Number 3. Declining nitric oxide. This is the molecule responsible for opening blood vessels. Your body makes less of it every decade. Without nitric oxide, even a healthy heart can't push blood through narrow passageways. Put these together, and suddenly morning firmness becomes unpredictable, then occasional, then gone. But, and this is the hopeful part, unlike other age-related changes, this one can be influenced tonight. Your erection is not powered by luck. It's powered by circulation, oxygen, and a nervous system that feels safe enough to relax. And that is exactly where the nighttime ritual begins. Section 2. The first step is clearing pelvic pressure. Before bed, most men follow the same routine. Wash up, brush your teeth, urinate, lie down, sleep. But very few men actually finish emptying their bladder completely. And those last few drops, the ones that stay trapped around the prostate, cause swelling and congestion overnight. So here's a step I give to every patient of mine over 60. The drain release. When you finish urinating, don't walk away immediately. Stay still. Take 2 fingers and press gently upward on the soft area between your testicles and your anus. This is the base of your pelvic floor, and it's the gateway to releasing any residual pressure. Most men notice a few extra drops. That's not an accident. That is congestion leaving your body. Why does this matter? Because a swollen prostate slows circulation. Slow circulation weakens nighttime erections. Weaker nighttime erections lead to weaker morning wood. This simple 3-second release helps your body start the night without internal resistance. Now, I've treated men who've been struggling for years, and I've seen the relief, emotional, not just physical, when something so small makes such a meaningful difference. It's not glamorous. It's not something you brag about. But when your body wakes up more relaxed and less congested, you notice the difference. And that's what we want. A small win every night. Section 3. The second step is releasing the pelvic floor. The pelvic floor is the hidden muscle group that controls your erection. It wraps around the prostate, supports the bladder, and pumps blood into the erectile chambers. But here's the uncomfortable truth. For most older men, it becomes tight, not weak. A tight pelvic floor acts like a fist squeezing a garden hose. Blood can't flow well, and the tissue cannot fill completely. That's where the rolling release comes in. Take a tennis ball, a massage ball, or even a rolled towel. Sit on it gently. Let your body weight press down into that deep layer of muscle. Then, rock slowly forward and backward. You're not pressing your prostate. You're massaging the muscle layer underneath it, the same muscle that controls firmness. The first time you do this, you might feel tenderness. That's normal. Most men carry decades of tension there without knowing it. But after 60 seconds, something remarkable happens. Your pelvic muscles soften. Your circulation opens. Your nervous system switches out of protection mode. This one step alone often improves nighttime erection quality within a week. Not because it's magic, but because you're finally removing the physical chokehold around your blood vessels. And yes, it often feels pretty good. Not sexual, just relieving. The same way stretching tight shoulders feels good after sitting all day. This is the foundation for everything that comes next.
Section 4. The third step. The breath lock that signals your body to repair. Here's a truth most men don't know. Your erection depends far more on your nervous system than your testosterone. If you go to bed tense, stressed, mentally wired, or breathing shallowly, your body remains in a sympathetic state, the fight or flight state. In that mode, your body does not prioritize blood flow to the pelvis. It prioritizes survival. That's where the night breath lock becomes powerful. Breathe through your nose, never your mouth. Inhale for 4 seconds. Hold for 4. Exhale for 6. Do this 5 times. This slow nasal breathing does 2 things that are essential for men over 60. 1, it activates your parasympathetic nervous system, the rest, digest, restore switch. This is the same switch your body uses to create erections naturally. And 2, it triggers nitric oxide release in your nasal passages. Nitric oxide opens blood vessels. More nitric oxide equals better nighttime erections. This breath lock prepares your body the same way a craftsman prepares his tools. Not rushed, not forceful, but intentional and steady. And for many of my patients, it becomes the moment your body says, "All right, let's repair, let's restore, let's rebuild what age tried to take away." Section 5. How everything works together while you sleep. Let's tie this together. When you release pelvic pressure, when you soften the pelvic muscles, when you activate nitric oxide and calm the nervous system, your body finally has the space, the circulation, and the biochemical signals it needs to produce strong nighttime erections, the kind that oxygenate your erectile tissue and restore your morning firmness. You're not forcing anything. You're cooperating with nature. And older men, listen closely, your body responds far better to cooperation than force. Younger men can push their bodies recklessly. Men over 60 must guide their bodies wisely. This ritual is guidance. And when practiced nightly, it becomes a message your body cannot ignore. Section 6. A gentle mid-video CTA. If this is already giving you clarity or courage, consider subscribing. It helps this community grow, and it lets me continue teaching real, practical solutions that older men rarely hear but deeply deserve. Now let's continue. Section 7. Why nitric oxide still matters even with this ritual. I want to speak honestly for a moment. Techniques help. Breathing helps. Releasing pressure helps. But if your nitric oxide levels are extremely low, which is common after 60, your blood vessels simply cannot expand enough to create firmness. Think of it like trying to inflate a tire with a pump that barely produces air. Your ritual becomes easier and more effective when your body has the biochemical fuel to work with. This is why nitric oxide support remains a valuable addition, not a replacement, but support. Men who combine nightly pelvic release plus breath lock plus nitric oxide support often report stronger morning firmness within 7 to 10 days, not because of supplements alone, but because tissue that has been dormant finally begins to awaken again. Section 8. The bonus step. Waking up the erectile tissue. If your morning firmness has been missing for months or years, consider this optional step. Gentle pumping therapy, not for size, not for aesthetics, but for oxygen delivery. The fitness world calls this muscle memory. The moment you stimulate tissue regularly, the body begins repairing it more aggressively. 2 weeks of gentle, consistent pumping can remind your erectile tissue what its job is, not through chemicals, but through circulation and pressure training. Most men who add this step see faster results, but I always recommend starting slow. This is rehab for older tissue, not a competition. Section 9. Bringing it all together. So tonight, before bed, try this. Release the last drops. Release the pelvic tension. Release the stress through your breath. Do this for 7 nights. Just 7. And pay attention to what happens, not only to your morning firmness, but to your energy, your sleep depth, your confidence, and the way your body feels waking up. Because when a man over 60 wakes up firm again, something deep inside him wakes up too. Vitality, pride, hope. That's what this ritual restores. Not just erections, but the feeling that your age is not controlling your masculinity. You are. Section 10. Closing words and final CTA. If tonight's routine gave you something new, something practical, let me know in the comments. Tell me how many mornings you plan to test this. Tell me whether you want more nighttime rituals, prostate guidance, or circulation training tips. I read every comment because your stories matter, your progress matters, and you deserve a voice in your own health journey. Take care of yourself tonight. Sleep deeply. Breathe slowly, and let your body rebuild the strength it once carried effortlessly. I'm Dr. Thomas Carter. Keep learning, keep growing, and keep choosing a stronger tomorrow.